Like that.
Yeah, so welcome. Thanks everybody for joining us on this beautiful night. For those that don't know me, I think I know everybody here, but for those in virtual land that don't know me, I'm Dr. Philip Rohde. I'm the medical director here at Rituva, and we're super excited tonight to have Dr. Neil Secrist joining us. Kristen and I had the benefit of hearing Dr. Secrist speak at our BioT medical training in Tampa, and we learned tons, like drinking from a fire hose. So we're really fortunate to have him come and join us tonight. He is a renowned national speaker, educator with BioT Medical. He practices at Evolve in Wichita, Kansas. And join me in welcoming Dr. Neil Secrist.
Very thank you. Oh, a nice introduction. I need to have him talk to my wife.
That's recorded.
It's on the recording. She can hear it. That's right. Okay. Can they see me okay there? I guess my head's kind of cut off a little bit. That's all right. So I'm responsible for all the rain you get. I brought it with me all 5 hours of driving through to get here. So we'll fill up your lakes for you and you make your yards green. Yeah, you're welcome. We get some of that ourselves. Yes, we're going to cover a lot of information. No, you're not going to feel like you got your mouth on the end of a fire hose, but there will be a test at the end of tonight. Kidding, there's no test. Yeah,
We have tests.
They had tests. Yeah, you had about 650 slides worth of information and an exam, and then you had a practical after that. So yeah, they had to learn how to do surgical insertions. Sounds hard, but they had the real test. That means they're well trained. Let's see here. A little bit about my background. I've been practicing medicine for 30 years. Any of you say you've done something for 30 years?
Yes.
You don't look old enough to have said that. I'll believe you. First, I was in the military sector for a while. I served 2 tours of duty with the Air Force as a flight instructor. Do I have any fellow veterans here? Okay, well, special thanks, or reach out to those of you who are friends of veterans. And it was an interesting practice. I took care of super healthy people that are responsible for our nation's defense. And I mean, let's face it, you got to be healthy or you can't be a pilot, right? But I had, I didn't come from any kind of a privileged background. I was probably the first person from my ancestry to go to college. And I just wanted more out of life than what I was destined to do, which was either work on the farm or in a factory. Not that that's a bad thing. I just wanted more out of life. And then I went on to med school, but the sore reality of all this is we didn't have any money. So me joining the military helped me pay for my college. And then I had these things that some of you have probably heard of called school loans. So I had educational loans. And so during the week, I'd take care of the pilots. And on the weekend, I'd moonlight in the emergency department because I needed to earn extra money to pay my school loans. Well, what it gave me over a period of time is a real interesting view of medicine. So during the week, flying with healthy people, super healthy, they don't need a doctor kind of thing. But on the weekend, I'm seeing everything that rolls in the emergency department. The car crashes, the strokes, the heart attacks, the babies, the fractured femurs, the runny noses and sore throat babies at 2 a.m. I mean, just everything. I'm just telling you, and what you develop is a very interesting perspective. During the week, I saw the healthy people. During the weekend, not so healthy. And what you learn is our system doesn't teach us very well on how to deal with chronic illnesses. So chronic illnesses are like what? Blood pressure, cholesterol, diabetes, COPD, weight issues, osteoporosis, cancers, autoimmune diseases, things that people kind of have to learn to live with. And so our system teaches us to fix and cure, right? That's our system. But what it doesn't teach us is necessarily how to look for root causes. And there, in turn, it doesn't teach us how to maybe look for a way to attack those root causes, a way to heal, if you will. So this is what I'm going to share with you tonight is a way to look for root cause issues and how to heal. So what I like this slide because it says the best medicine of all is to teach people how to not need it in the first place. So that's what we're going to talk about. People come to me, and if we can find the root cause and address it, guess what? We take them off medicines because they don't need them anymore. So that's what I call healing. So to do that, we're going to talk a little bit about this topic, Hormones. Here's our 5 bullet points for tonight. What are hormones? Differences between synthetic hormones and bioidentical or human identical. Okay. What are the different ways they get into your body? How they can help men and women? What are the risks? And whether or not you listening here now or online or in the recording, whether or not you're a candidate for something like this. Okay. Simple. That's what we're going to cover. So I went into medicine to learn healthcare. A lot of people that go into the medical field want to learn healthcare. They want to learn how to give health to people. The system, however, teaches you disease management. It teaches you how to manage and treat chronic illnesses. The issue is it doesn't teach you how to really look for root cause nor focus on healing. So we kind of get the goal moved in front of us. You come out of there being an expert in disease management, but you really haven't learned how to give health to people. That's the system. Okay. Conventional traditional medicine. I was trained in that. I'm board certified in family medicine. I did ER medicine for 30 years. I did family medicine for 20 years. I did all the colonoscopies and the EGDs for our group for 20 years. I've delivered 111 babies. Some people call me a real doctor. Okay. Here's my system. This is what I was trained in. We're born, and for 10 to 20 years, we're getting better. We do well. We have great reserve capacity, and then things kind of start downhill after that. And our system teaches us how to help people live longer, but it doesn't teach us how to keep our quality of life. So we say we can help you live longer, but if you have a hip fracture and a stroke and all these things, your quality of life doesn't go, but we can help you live longer. So I don't know about you. I don't know if I want to be into my 90s if I have to spend my last 5 years curled up in a bed somewhere. Okay, I want to be a productive member of society. I want my quality of life. Traditional conventional medicine says, treat the blood test, not the patient. Treat the result, treat the lab test, not the patient. So this was kind of me. Current medical disease model. Hi, come on in. Current medical model is known as disease management. There's me. There's the cliff. I'm the guy in the ambulance at the bottom of the cliff catching patients as they fell off the cliff into my ambulance, and I would either treat them and street them, or I would treat them and admit them to the hospital, depending on what we need to do for them. So what I realize is, how much better would it be to put up a guardrail? Let's focus on primary prevention, how to not get those chronic illnesses in the first place. So this is Dr. William Osler. Some call him the father of modern day medicine is what I'm trying to say. The person who takes medicine has to recover twice, once from the disease, second from the medication, meaning the medications can have side effects. So this is the challenge we took on many years ago. When you first go through medical school, you learn the motto or the principle first found 4,000 years ago in Huang Di Dai Ching, the first Chinese medical text. It says superior doctors prevent the disease. Mediocre doctors treat the disease before it's evident. Inferior doctors treat full-blown disease. In a way, I kind of felt like I was that inferior doctor in the ER, but I hadn't seen those people before. I was treating full-blown disease. The superior doctors, those show people how to prevent that. So here's where we spend our time now. Regenerative preventive medicine. Some call it functional medicine. Others call it precision medicine. It focuses on the patient as an individual. And what we do is we have that quality of life, but right about when things kind of start downhill, we teach you how to extend your vitality, extend your quality of life. Not just live longer, but live longer with a higher quality of life. Best depicted by this. These two people are the same age. Right? And so what we want to do is give you years, not just years to your life, but life to your years. Does that make sense? We want to give you health span, not just lifespan. That's precision medicine. There's that functional medicine approach. Said another way, you see these little blue circles made simple. The center one says depression. So let's say the guy comes in and he's all down on things, maybe losing hope. Traditional conventional medicine says, oh, we need to give him some antidepressants. Okay. Well, here's the real question though. Does he really have like a Prozac deficiency or a Wellbutrin deficiency or a Celexa deficiency? Or does he have things going wrong with his thyroid, his hormones, and his vitamin D? Are there other root causes? He might need those in the short term, but he doesn't need them long term. Okay, so if we can identify the root cause, maybe we get rid of the need for the antidepressants in the first place. That's a functional medicine concept. So hormones are those root ways we can identify underlying causes. So here's the question. Do we lose our hormones because we age, or do we age, therefore, because we lose our hormones? Does that make sense? Yeah. So I believe that the aging process accelerates in the absence of optimized hormones. That's exactly the development of many of these chronic illnesses. So here's what you need to know. Let's see if we can get this for you. Okay. Not all hormone therapies are created equal. They're all different. We're going to cover some of those. Hormone replacement therapy is not a one-size-fits-all approach. It has to be customized to the person based on their activity level, their blood levels, their kidney function. All of these things factor into a customized dose. Number three, you need somebody that's a certified expert. You need somebody that knows the literature, knows the data, knows the different delivery systems, knows how to customize a dose. Number four, you want to focus on a concept called optimization, not just normalization. So what do I mean by that? So let's say, let's think about it. Some of us at some point, we all reach a season of our life where we say, I don't feel myself anymore. How come I'm tired all the time? Why do I have dry skin, brittle nails, foggy memory, constipation, low energy, elevated cholesterol, brain fog, cold hands and feet, poor libido, not getting results in the gym, I'm gaining weight. My sleep sucks. I've got hot flashes, night sweats, bladder leakage, joint pain, sleep troubles. I'll keep going if you want, but that starts happening to people and say they don't know what to do. And so what they typically do is they Google it, because people just Google everything these days. Google may say, go get your thyroid checked. Okay, great. You go get your thyroid checked. And then there's a range. So your thyroid has a blood test, and there's a range that it falls under. And oftentimes they call you up on the phone. They say, hey, we got your blood test back. Looks to us like you're in the normal range. That's the words they like to use. They're referring to the reference range. So the reference range is a bell-shaped curve that's this long. It might have been here when you were younger, but it migrated to over here on the lower part of the range, which created the symptoms. So you might be told you're normal, but you don't feel normal. But if we put that over on the right side of the curve, now your symptoms get better. Okay, so both are normal, right? The low is the normal, and the optimal one is the normal. Which normal would you rather be? See, we call that optimization, putting you on the right-hand side of that curve. And then it has to be customized. It has to be unique to the individual as opposed to generalized. There's an example. Do you still feel sick, but you're told that your labs are normal? Okay. They're in the reference range, but they're not where maybe you feel your best. So this concept is a rolling back the clock strategy, resetting your blood to the levels that you felt your best in. Remember, only you live in your body. No one else does. So you know your normal for you and what you feel best. And that's what the BioT method does. So some people say, hey, do I feel like this, but I'm told my labs are normal? Or do I feel like this, having optimal labs? Or shows a picture of this, not feeling so good, or you have optimal levels and you feel like this. Or maybe you feel like this. Let's see if I can get this. Dating myself. How many of those from Saturday Night Live or way back, right? Yeah. Okay. Well, I think that guy just has hormone insufficiency. That's his deal. I mean, his hormones aren't messed up. So if that sounds familiar, I'm not going to read all these bullet points, but let's just look through the list and just say, hey, can I identify with any of those? Chances are we have some hormone insufficiencies going on for various reasons, whether it be environmental pollutants, toxins, food choices, life. It's kind of beating us down a little bit. So our levels drop, so these symptoms show up. So fatigue is one of them. Okay, so I'm here in Columbia, right? Home of Mizzou, right? I went to a little school nearby here. Some of you heard it. The name used to be Kirksville College of Osteopathic Medicine, now known as what? A.T. Still University, just 90 miles up the road. Am I right? So some people get fatigue. Anybody here know someone that's tired? Two hands go up. Okay, okay. What do people do in Colombia if you're tired? Let's say you're in the middle of the workday, you can't lay down and take a nap. You got to keep going. So what do people do?
Caffeine.
Coffee, caffeine, energy drinks, right? Okay. They sell energy drinks here. What are those run, by the way? I have no idea. I bought one the other day. I was so shocked at what they cost me, but I'm curious. What is that run?
$3 to $5 probably.
$35. Okay. I mean, I believe you.
Just 2 for $5.
Right. You go to Costco and you buy a box of them. You know, there's different sizes, right? 10 ounce, 20 ounce. Okay. So what we're doing, I have a patient that came in to see me. This guy's like mid-20s and he was having anxiety attacks and stuff like that. So I asked him, I said, hey, do you ever drink energy drinks? And he goes, oh, yeah, I drink one every day at 3:45. I'm like, okay, well, why that? He goes, well, because that way I have enough energy to finish my shift, drive home through the traffic, and get home into my living room before the crash hits. So he's learned that if you borrow energy from the future, you have to pay it back. So he wants to get home before his crash hits. So that's what we're doing when we borrow energy from the future. Okay. Does he really have a monster deficiency? Not really. I mean, we're borrowing it. Chances are it's probably hormonal. So the traditional conventional medicine says treat the blood test. Functional medicine says no, treat the patient, not just a blood test. How do we treat the patient? We do a symptom checklist. Some of you were given a symptom checklist. If you're listening online or in the video, this is what those papers look like. So this checklist, one for male, one for female, assesses, you get a self-rate how you're actually feeling before things get started. It gives you a chance to rate that. I pay a lot of attention to that. In fact, 80% of the weight of my judgment for a dose is determined by that checklist. I need the blood levels about 20% to help guide me. But the checklist makes a difference. Why? Because if we do treatment, we repeat the blood test and we repeat the checklist and we lay them side by side. And I want to make sure those symptoms got better because that's the main reason that people seek that. Not to mention all their chronic illnesses are going to, improve or go away. Okay, so here we go. Hormone production levels and optimization of men and women. There's that curve. We're getting older. The hormones are dropping. All these symptoms are showing up. But look at the positive side. As we restore the hormones, back comes the energy. Back comes the libido. Back comes the better sleep and relief from joint pains and the ability to lose weight. And then the protection for cancers, heart disease, Alzheimer's, those start returning as we optimize our levels. That is the long view. The BioT method basically does what? You balance out 4 main items: testosterone, estrogen, progesterone in women, vitamin D, which is a pro-hormone, and of course thyroid. Okay, so 5 things, if you will. And then we use medical grade nutraceuticals to make the pellets work better and last longer, or hormones in general. Okay, so quick coverage of some of these: andropause. It's male menopause. Some call it manopause. I thought that's kind of cute, right? 20% of the males over 50 have low testosterone. I will tell you clinically, it is way higher than that. Way higher. And I'm seeing levels of 50-year-old men, testosterone levels showing up in our 20 and 30-year-old men. They're coming to see me. They are hormonally way deficient than as youthful as they are. I see the same thing in women. Okay, common with diabetes, blood pressure, weight issues. It's underdiagnosed. Testosterone, if we talk about that, that provides major symptom relief and protection in the bones, the brains, the heart, and relationships. Testosterone is present in both men and women. It's the major dominant hormone in men. There's smaller amounts in women. Men start losing 1 to 3% per year beginning in their 30s. I've seen it in the 20s. Women start losing testosterone 15 years before menopause starts. 15 years. The most common time frame, I think, is the lady, she comes in to see me. She's perhaps in her early 30s. It's after the birth of the second child. She can't quite keep up as much as she did with the first child. She doesn't know what's wrong with her. How come my energy's not there? I'm not thinking straight. Those big hormonal shifts, she started losing her testosterone very early. And that's what's replacing some of those. So there's a lot of symptoms that happen below the surface. The men might show up thinking they need a little blue pill or something like that, but below the surface, they have a lot of other things going on. So here's a chart that I think is remarkable. It shows serum blood testosterone levels in young men. Okay, so think of a young man. Okay, you might know levels should be 800, 900, 1,000. We don't see that in this day and age. I've seen testosterone levels markedly lower over the last 10 years of my male populations, much more than it was a previous decade ago. As we start losing our testosterone, us men, we gain weight in our midsection. I got to tell you, we don't like that. Our muscles soften. We don't like that. As it drops below 900, we lose the protection for Alzheimer's. Below 800, we actually have increased risk for prostate cancer. In the 770s, we get metabolic. Our bones begin to thin. Down here in the 400s, our energy's dropping. Our libido's dropping. In the 300s, the cholesterol's rising, as does the heart disease. In the 280s, now emotional things, depression, anxiety, even PTSD tends to surface. And not till it gets clear down here into the low 230s does the plumbing get affected. That's the last thing to show up while many of these other factors are in play. So us men, we not only we need our testosterone. What do we need it for? We need it for our brains and our bones and our heart, not just our relationships. So one of the therapies, the one we're talking about here today, ramps us men right up here to maybe 1,000-ish. And then we're off and running for 4 to 5 months. And the nice thing about it is it's released based on cardiac output, which means as I work more and move more or do more workouts, my levels go higher, which is different than synthetics and other forms of testosterone. Now, if we compare this to women, you could probably just scale that all the way down, nail it down, but women still need testosterone. Instead of prostate cancer, of course, those risks for breast cancer go down. We'll talk about breast cancer shortly. Some men will hear from time to time, I know I did medical school, that, hey, I don't know if I could take testosterone. Doesn't that cause prostate cancer? We may have heard that from time to time. We actually know that that's a myth that's not been proven at all. In fact, the opposite is true. There are 19 studies that show there is no increased risk of prostate cancer in men that are on testosterone therapy. In fact, men with low testosterone have a higher rate of prostate cancer because of living a life of low T. It offers that protection. And when they show up, it's higher grade and it's more spread had they had testosterone in the first place. So testosterone gives us important positive effects for men and women. Gives us back the energy that we are seeking. That way you don't have the need for the energy drinks. Okay, depression, anxiety relief, improved cognitive function, memory, reaching for words and things like that gets better. They can focus. They have better libido and performance. And for the chronic illnesses, we're protecting from prostate and breast cancer. We're protecting from Alzheimer's and long-term dementia illnesses. We're making the bones stronger. We're protecting the heart. And we're getting better bone strength, reduced body fat, and improved cholesterol numbers. In fact, this chart actually shows an improvement of all the bad numbers going down and the good numbers going up as it relates to your cholesterol blood tests. This is just a chart that's actually my own personal medical data. I don't mind showing this. This was taken a few years back. And basically, this is a scan where I laid under the CT scanner. I held my breath for 10 seconds and they scanned my heart arteries to check and see if I have calcium buildup or calcium accumulation. It's called a coronary calcium score. Some of you have probably heard of those. So it says right here, my total calcium scores. Can you read that? You're in the front row. What does that say right there?
0.
Total calcium score is 0. Wow, I'm thankful for that. And according down here, it says my coronary age is what? Can you read that?
Less than 3.
Less than 35. Now, I don't know whether that means like 29 or 25. I'm thankful, right? But that's the case. My wife did the same thing. And so they say in Texas, it ain't bragging if you've done it. So I'm thankful for that. We get to do a lot of fun things. Not have to worry about the heart disease. Okay, menopause. Ladies, you're up. This says 3,500. The new numbers are in. 4,000 women a day are entering menopause. They don't really ever get through it. It starts 15 years earlier because of the testosterone dropping, and they don't really ever get through it. Whether or not they have hot flashes and night sweats, those may go away for some they do not. The long-term problems with menopause are fraught with osteoporosis, heart disease, breast cancer, and then dementia. And I don't think there's any lady that wants to sign up for any one of those programs anytime soon. So menopause is definitely can be better in a lot of ways. As the testosterone drops, so the heart disease goes up. Until the ovaries come offline, menopause, said another way, is primary ovarian failure. When the estrogen goes to 0, the rate of heart disease shoots up to 1 in 3. The same as their male counterparts. Okay, so estrogen, that's important. It's present in both men and women. Wow, us men, we have estrogen. Did you know that? We need a little bit of estrogen. It's what makes us nice. If we don't have enough, we have a problem with that. We need some, but we don't need too much. It's a major hormone in women. It's helpful for so many functions in the body, controlling hot flashes and night sweats, making the skin so youthful appearing, helping us with the happy hormones of the brain, making our bones stronger. We're actually reversing osteoporosis by doing this therapy. Are you listening? Reversing bone loss using this therapy, maintaining memory, preventing neurodegenerative diseases, improving the cholesterol numbers and heart disease. So hormone therapy, here's what our choices are in this day and age. These are basically the choices. This is the menu. Synthetics or bioidenticals, also called human identicals. Synthetics are put together typically by pharmaceutical companies. They're typically derivatives of animal urine or feces. I know that sounds bad, but it's true. Okay. They are available to take in the form of pills, patches, or shots. Thank you. And there's a bunch of different types out there. Then there's the human identicals, meaning the same molecule is produced by the testicle or the ovary, the exact molecule. That's also available as pills, patches, creams, or gels, and then pellets. Pellet, what's a pellet? Let's talk about that. By the way, this study was out 20 years ago. At the time, they thought it was a good study. They realized very quickly it was wrong. But at the time, it got a lot of fanfare. In those days, we had things, some of you don't know what these are, but we had things like magazines. And there was like Time magazine and Newsweek. Some of us know what those are. The rest of us are like, what are they? What is he talking about? Right. They published this data and they thought that all hormones were the same. They all cause stroke, heart attacks, breast cancer, blood clots, and Alzheimer's. So the medical community freaked out. The lay community freaked out, said, oh my God, we can't take those hormones. What were we thinking? The data was flawed. They came out later and said, oops, we were wrong. They found out that it wasn't all hormones. It was just a synthetic oral progestin, oral estrogen and progestin therapy. It was that one little arm of the study that they broadly extrapolated to all hormones in general, and they were wrong. But the damage was done. The community was scared. Medical schools got teaching it. So we had 2 generations of women that were lost to preventable illnesses because they all came off their hormones. Okay? And the bad part of the drug that was causing these things showed increased breast tenderness, increased risk of endometrial cancer, heart disease, Alzheimer's, and all the unfavorable symptoms. Okay, that was just that oral synthetic progestin taken again with the oral estrogen. It's that one little subtype. Okay, so people now are realizing, wait a minute, I need to get on my hormones to live longer, healthier lives. There's different delivery systems. There's the patches. You put the patch on somewhere on your arm or on your hip, something like that. The problem is you can get significant side effects, and 45% of people don't absorb properly. And you got in the patch lasts 3 days, you got to put on a new patch. So you can put a cream or a gel on, you put it on twice a day. When you take it, you can get a spike in your bloodstream as high as 800, and then it wears off. You can transfer to others, including your babies and your pets. So people don't like that. It's messy. This is common in the male sector where men will inject testosterone. How many of you have heard of someone that's had male has testosterone shots, right? Done properly, you have to do that shot. By the way, you get a big spike, goes up to 2,500, maybe 3,000, then it trails off. So it lasts for a few days and then it wears off. Then you have to wait till your next shot. So the men feel good for a couple of days and then they take a nosedive. They feel good for a couple of days and they take a nosedive. And so they literally ride a hormonal roller coaster. It's synthetic. It actually raises the cholesterol numbers. It's the cheapest form of testosterone, which is usually why a lot of the men will start there. But the problem is it has a lot of side effects. Done properly, it should be done twice a week, not twice a month. So how many weeks in a year? 52. So it's 104 shots a year. I don't know about you, but if I was thinking shots, I could not get excited about giving myself 104 shots a year. And I'm not even diabetic, right? Okay. So, bioidentical hormone pellets. All right, come on in. So, hormone pellets. These are natural plant-derived compounds. Same molecular structure as the human hormone. Okay, lasts longer than other treatments. It lasts up to 4 to 6 months in males, okay, 3 to 4 months in females. It's the most widely studied. It's been around 80 years. Individualized dosing. Everything's customized to the person. Implanted under the skin. Most people don't even know it's there. Remarkably popular therapy. Again, been around since 1940. All kinds of data and studies. Here's your comparison of your different delivery systems. So your pills have to be taken daily because you take them and they wear off. And so you have to retake it and then it wears off. So you get these up and down spikes all day long. Sorry, all week long because you do it daily. The patches last 3 days. And then there's the pellet, steady stream, steady state, just like the body, just like the ovary and the testicle. Nice steady state, and again, released based on output. So the BioTE method gives you the right kind of hormone, not a synthetic. It gives you the right amount of hormone. It's all individualized to the person. And it gives you the right delivery system in the form of the pellet, which mimics the actual human ovary and testicle. Safe and evidence-based. It's been around for, this says 75 years. It's actually closer to 80. Best method to increase bone density. No evidence of blood clots, breast cancer, heart disease. In fact, those risks all go down. Regarding breast health, we get that question from time to time. Hey, my mom had breast cancer. I'm told I can't take hormones. Well, that's not true. It's actually, if you get pellet therapy, you can actually lower your risk for breast cancer by almost 40%. That's a very large study that was released last year. So that's kind of wonderful. More breast cancer data information right there. Bone health. We have ways of helping osteoporosis. The oral therapies improve at 1 to 2% per year. We can more than quadruple that at 8% per year with pellet therapy. Wonderful. I've got countless ladies from my practice who come and we reverse their bone densities. It's getting popular. Come on in. Hi. Come on in. Arthritis. 10% of men and women have arthritis by 2020, which is past of us. It's the fourth leading cause. Testosterone is a very potent anti-inflammatory, so it helps joint pain. You may hear that shared tonight. Brain health. Women get Alzheimer's 8 times the rate of men, primarily to the drop in estrogen. Women on estrogen are 50% more likely. Men with low testosterone are 3 times more likely. How about heart disease? Number 1 killer of Americans. Okay, unfortunately, the addition of testosterone does not negate the favorable effects of estrogen. Women experience a marked reduction in their fat, as was seen when they give estrogen plus testosterone after 2 years. Kind of cool. So what else is important? Thyroid. Thyroid is basically your metabolism, hair, skin, and nails. Is there anybody here that wants better metabolism, hair, skin, and nails? 2 of you? Okay, the rest of you now? Okay, bye. There's thyroid, there's vitamin D, progesterone, women only, helps them relax at night, helps them with anxiety and depression. So basically live a better life. This is what everybody's reaching for. They want a root cause, evidence-based thing. They want to focus on healing. They're tired of the fixing and curing. I think a lot of practicing physicians, practicing nurse practitioners, PAs, we get tired of seeing our patients come in each year and their Ziploc bags of medicine are growing, not shrinking. We need to work on the root cause of this. This gives us a way to do that. So the next step is simple. If you're experiencing some of the symptoms, fill out a checklist. Get your blood test. It's that simple. Blood tests are simple. We can measure all that stuff. Here's your summary slide. Shots, 50 to 156 per year. Creams twice a day, 700 times a year. Pellets 3 to 4 times a year for females, about twice a year for males. So it's pretty remarkable. Potential temporary concerns of the first insertion. Just like any therapy, there is potential concern of some temporary things if it happens at all. Testosterone makes the kidney work better, for example. So some people get a temporary retention of fluid. That happened to me. I got pellets. I got a little bit puffy. I got to feel what my wife felt like on a monthly basis. And so I took a diuretic. I peed it all out. It's never come back since. So we can see that the pellet can uncover in the uterus if there's a hidden polyp or a hidden fibroid. We might get some spotting. We would discover that and deal with that. If you don't honor your P's and Q's and restrictions, you could pop out a pellet. Rarely is that ever serious. You could get some temporary breakout of acne. All of that is very treatable and reversible. Men can experience a reduction in the size of the testicle and the swimmers, which is true with any kind of testosterone therapy. So we give you compounds like nutraceuticals, DIM, for example, to mitigate that. Okay. So there's your key facts. Hormone imbalance can occur at any age. It's not a one-size-fits-all approach. You need to find a certified provider, and even though your labs are low normal, they may not be optimal. Okay. So let me just ask here, is there anybody here, I know this is kind of a new practice, that's had a chance to use pellet therapy and wouldn't mind sharing it with the group? Well, you guys mind? Ladies first, as chivalry's not dead in my household. You might share with the group. I'll just hold the microphone for you. And you are?
I'm Krista. I'm a physician assistant. I do mostly emergency medicine, so I was skeptic. Living on Celsius was my energy drink of choice. But it is true, I would drink so many energy drinks that I would shake and just feel jittery, but still was very, very sleepy. I slept a lot. The thing that made me get checked, honestly, was brain fog. I could not remember things that I knew. Constantly. It was affecting my work. It was affecting my life. I'd be talking to my family and I would just stop mid-sentence because I could not finish what I was thinking or talking about. Eventually that all led to some, depression, and I was very frustrated with it. I started gaining some weight centrally, which was very weird for me because I work out a few times a week, and I have a trainer that helps me with my nutrition. Shout out to Evolved. If they're on here. And I just was gaining weight in areas I had never gained before, but ultimately it was the brain fog and just feeling so tired and depressed all the time that made me go. I initially had a lab. Being a traditionally trained medicine person, I didn't believe it. I refused to get treated. So I rechecked it a year later, and when it was more severe, and then decided to get treated. And I've been on pellets for a year and a half now. And everything is much, much improved. So I decided I wanted to start doing this for other people because I know there are a lot of people out there like me that are having the same issues I was having, and were feeling quite hopeless. And I was like, if I feel like I'm 41, if I feel like this at 41, I don't want to live to 81 because this is miserable. So my sleep is much better. My exercise is much better. And my brain fog is markedly improved. My mood is better. I think, anyway, I've asked my boyfriend. I would say the biggest testament to how I feel about BioT is that once I became a BioT provider, the first people I pelleted were in my family. And obviously they're the most important to me. So that speaks volumes about how I feel about this product as a whole.
Wow, congratulations. Anybody else notice other than you on how you feel?
My boyfriend and my sister. So I think they all would say it's been a massive difference for me. And sorry to say, I drink like 1/4 of the amount of Celsius I did before. So they noticed too, because the energy drink people were making a lot of money from me. Yeah, a lot of money. So
Wow, good. Well, round of applause for Sean. Yeah. So, did anybody pay you to say that?
no.
Right, but now you want to take it to your group or your patients because you're realizing it yourself.
Yes.
Yeah, we hear this a lot. Come on up.
And
Who's this?
like Krista stated earlier, I'm her boyfriend, and I'd seen a lot of her results and how well it was working for her. And I was lethargic and tired of life. I do have type 2 diabetes and was just noticing my energy levels going down more and more every year. And when I did start with it, the energy levels came back really quickly, but then there was a bunch of other side benefits that I didn't even realize were going to happen. I do remodeling for a living, so I'm very physically active and move around, and I have a lot of joint pain. And all of a sudden one day I went to do something that normally makes me wince and just kind of protect myself a little bit. And all of a sudden I realized it wasn't even there anymore. And it's like, and then I started noticing a lot of other improvements with all my inflammation and joint pain. So, and my sugar levels came back to normal a lot, and got off of cholesterol medicine. So there's been a lot of benefits, and I've only been on it for 5 months. So
Wow. Is he a different person as a result of this?
Yes.
29 pounds lighter since,
Oh, so you shed some weight.
about 29 pounds.
Yeah, he was living on ibuprofen. I was convinced he was gonna be a dialysis patient. He rarely takes ibuprofen anymore.
Don't need it.
No.
Testosterone is a very potent anti-inflammatory, so that's what he's described to you. Wow. Glad you did it.
Oh, absolutely.
What are your chances of quitting anytime soon?
I'd never go back to not.
We do get a lot of lifers. Thank you very much. Well, that kind of begs one question. Some people ask me, hey, doc, is this therapy? If I start this, is this something I'm going to have to do the rest of my life? We get that question from time to time. What I've learned is that once you start the therapy, now the question changes. The new question is, hey, doc, is this something that I can please do the rest of my life? And the answer is yes. By the way, I have 3 patients who come to see me that are in their 90s. They love it. My mom gets it. She's had multiple ones. She's in her mid-80s. You cannot age out with this therapy. Okay, so energy levels, relief from anxiety, depression, increased drive, mental focus, concentration. So these are some of my patients. My patients, they have my text number, so sometimes they'll tell me how good they're doing. I warn them, anytime they text me, it could show up in a presentation somewhere. So some of these are just that. Okay, so let's move on. Yeah. Nutraceuticals, final slide. In order to make the pellets work better and last longer, we use some very specific medical grade nutraceuticals. Okay, so some of these are your unique forms of vitamin D, DIM, and other compounds that'll mean more to you later. So with that, I just want to finish it off. I'll field some general questions. We got people online. We have people on the recording. They're going to hear this. If you have any general medical questions about hormone therapy in general, okay, I don't want to ask you to tell me your personal private medical question. We can do that once we stop the recording. But for the group, if you have questions about hormones, you think the listeners might want to know, now would be a good time to ask.
I think a good question, quite honestly, Dr. Secrist, that I get a lot is, does it hurt?
Does it hurt? Okay, does the insertion of the pellet, right?
Yeah, what's that?
Great question.
Mhm.
So what we do is we not only, this goes into an upper outer area of your outer hip. Typically, we could also possibly do flank. what we do is we numb it up with a needle, numb it up. I place a little nick in the skin, slide the pellet in, and put a steri strip over. It doesn't even require a stitch. So it's very minor subcutaneous procedure. And we use numbing medicine. So that's probably what hurts, getting numb, just like if you were having stitches, or not even as much as that, I don't think, is, or at the dentist. So very quick and very simple. So no. You might be sore a few days afterwards. For the males, we give them some pellets. So we just ask you to put a little ice pack on it, but it's nothing.
On that question, like, so if you do the cut and put it in, out, like how much activity can you do without risking it coming back out?
Great question. So for the males, we ask them to not do anything lower body for 7 days. They can walk, they can go up a flight of stairs, but we don't want them running, jumping, stair step, or elliptical bicycle. We want them to protect their investment. A way to avoid that is a flank insertion. So we can go above the belt and they don't have those restrictions. So a lot of my athletes
had a really good luck with that.
yeah, great
I
question.
was just saying, because like jobs wise, like you said,
Yeah.
you know, like
That's why I did it. It didn't slow me down a bit.
I have a lot of fire, police, and military people that are extremely active by what they do for a living. And so they do great with it. Great question. One other question I get from time to time is cost. I get that question from time to time. Pellet therapy ends up being, let's see, what do you all charge for your females and your males?
$375 for women, $750 for men.
Okay, $375 for females, and the therapy lasts 3 to 4 months. $750 for men, and that therapy can last almost 5 months, maybe 6 in some cases. If you do the math, it comes out to about $3 to $4 a day. What were they? What is the cost of those energy drinks again?
2 for 5. If you drink 3 or 4 of them a day, $8, $7 to $8 a day.
But even so, it ends up being about the same price. What many of my patients have discovered that were energy drink users at the time is they say, I realized I was already spending the money, but now it's going to something else. And now it's going to something to restore their health and help them long term. They don't need the energy drink anymore. So it's a great question. What else?
Does ever cover this?
Does insurance cover this? Another great question. So I love that question. Insurance companies are in the business to make profits. Okay, they are part of our healthcare system. And they oftentimes will call something like this not medically necessary. They'll say, we're not going to give coverage to that. And because they're looking for reasons to increase their bottom line profits, that's their business. I get that. I have health insurance. I receive health insurance. I understand all that. But they don't see this therapy as they want to make you normal, not necessarily optimal. So it depends on the plan, depends on the person's plan within the plan. And it all depends on their medical diagnosis. In some cases, you are getting some insurance coverage. It's on a very limited case by case basis. But what can be done is they can use flex spend, HSA, MSA, all those kinds of funds are all eligible for not just the therapy, but also the nutraceuticals. Maybe that's helpful. Good question.
A lot of people ask how long after you get the pellet is it before you feel better or you start noticing improvement?
Great question. So the question is, how soon after the pellet insertion am I going to notice a difference? Depends. So for ladies, especially the ones that have like hot flashes and night sweats, they get relief of those symptoms sometimes as soon as 3 days. The testosterone takes more like a week to kick in, so it could be 1 to 2 weeks or maybe even slightly more for the males to get their levels up to the level they need where they feel it. So it can be anywhere from a few days to a few weeks, and it's dependent on the person. Great question. All right, any other ones?
I have a question.
Yes, ma'am.
You said testosterone levels have dipped drastically in the last decade. Theory question, why do you think that is?
Yeah. So the question is, again, I'm repeating it for the people that can't hear, is I've noticed men's testosterone levels drift down over the last decade. Now that I've been doing this for 20 years, I've seen those changes. They've actually changed the lab reference range. I watched it shift a few hundred points to the lower part of the curve since last decade. And we think that's primarily due to a couple main things. Food choices. More people these days are swinging through the drive-through as opposed to maybe more home-cooked meals. Our soils that build those things have been more depleted. Lifestyles. environmental pollutants and toxins, all those things push our testosterone levels down. As we gain weight sooner, that pushes our testosterone levels down. So a lot of reasons, but that's what I've explained. That's what I've understood to happen. We don't like it, but we have to deal with it. Yeah. All right. Well, thanks for having me. And one more question. Go ahead. Yeah.
So like from the time you said you customize it to everybody. So you come in, say you do it, how long is it like you do some blood work and like how long before you get that customization to what you're going to do, the pellets that you're going to.
Great question. So the process is you would draw your blood first, and then you would meet with one of the certified experts here, and they would go through the blood test with you. If you decide to do the therapy, they would insert your pellets, let it absorb. We recheck the blood in about 4 weeks for the males and about 6 weeks for the females. We repeat the symptom checklist and the blood test to make sure you're improving. If you're not improving, we give you what's called a boost. There's no additional charge for that. And then you should be off and running. Some people, depending on how long they've been out of hormones or very low, it could take a second, maybe even a third round of pellets for them to get fully on board on how they feel. My office manager is one of those classic ladies. She doesn't look a day over 39. She's 50, but she would never admit that. She's 39. She looks great and she feels good. She trains for marathons. I've been pelleting her now for almost 2 years, and she told me it was finally her third round of pellets that she felt pristine. She felt good right out of the gate, but she didn't feel herself till 3 rounds. That's not very common. Most people feel something right away. I would say 90% or more feel good that first round, but some people could take a little long. Long answer, short question.